Radiation monitoring devices are also known as thermoluminescent dosimeters. The film badge registers a charge over time as it is exposed to radiation. Dosimeters are turned in quarterly here, at which time we receive reports that display the quantity of millirems of radiation that each veterinary staff is exposed to. All veterinary staff members who are assisting with taking radiographs should wear a dosimetry badge. Secure the dosimeter badge on the outside of the gown at the thyroid level. The annual MPD for veterinary staff is 5,000 millirems. Okay, so I'm going to review the dosimetry reports, our reports in quarterly. It does the dose equivalent in millirems, which is accurate for the radiation amount that you're exposed to. And then for mine, for that quarter alone, it is 81 millirems of radiation that I've been exposed to. So the amount of radiation that I've been exposed to in that quarter alone is significantly less than the annual MPD, which is good. We're now going to put on our personal protective equipment. So we have our leg gown, which the majority should go on the front, and then they typically have ties that go around your body and around your waist. So you want to secure it to you so it doesn't slide off while you're taking radiographs. We also have our dosimeter badge, and we have our thyroid collar. So we want to make sure that that is secure over your thyroid, like so, and then don't forget to put your dosimeter badge on the outside of your gown at thyroid level. Personal protective equipment that we don't leave here are the protective glasses as well as lead aprons. It's important to visually inspect your personal protective equipment prior to each use to make sure that the integrity isn't compromised, such as rips or holes. Free methods of restraint include chemical, manual, and equipment. The chemical aspect of restraint is such as sedation and anesthesia to help keep your patient comfortable as well as still during these radiographs. The manual aspect is more like holding, physically restraining the patient. Then the equipment part, such as ties, you can use gloves or sandbags to help keep them in place, and troughs as well help to keep the patients straight and aligned during radiographs. A commonly used positioning aid is tape. You can actually use it to help separate your digits, such as in a dorsal palmar view of the feet. So what you would do is you can just gently wrap it around the digit and just kind of pull it to the side just to help separate the digits there. We also use stretch gauze to help better position the extremity or the paw that we're needing in the view. We also use leg gloves. You can also use sandbags. It helps keep them aligned as well as still. It just kind of adds some pressure to keep them in place. Physical barriers used in radiology are such as the movable barriers. That's there to help people who are exposed to a higher quantity of radiation than normal. Distancing yourself from the source of radiation helps to decrease the intensity of radiation, whereas fast exposure time helps reduce the amount of time that someone is exposed to radiation. The primary beam is where the largest volume of radiation is directed, so it's really important to stay out of that. Even when you're wearing items like your leg gloves, that only helps to reduce 25% of the beams. Only those taking the radiographs should be exposed to radiation. All non-essential personnel should be removed. That way they don't have an increased risk of receiving radiation exposure. You should make every attempt to get your diagnostic radiographs on the first take because it reduces radiation exposure to the staff, to the patient, and it also helps to keep patients stressed down. Woman's pregnancy, the first trimester is when the fetus is most vulnerable to the radiation. So that's why pregnant women really shouldn't be around radiation at all. OSHA established a maximum REM that anybody should be exposed to. So the formula is N, which is the number of the person's age, at minus 18, and then you multiply that by 5 REMs to get the maximum of safe exposure. I'm going to request Dharma's cranial caudal radius and ulna view. So we've got our scheduler pulled up. We're going to go into Dharma's patient clipboard and add it to her patient visit list under x-rays. And we're going to put this under the doctor who's performing the radiographs and put the description of the radiographs that we're taking, which is our craniocaudal radius and ulna. And now it's time to take the x-rays. Our measurement is going to be taken at the midshaft of the radius and ulna. Okay, so it's at 1.5. Okay, so the midshaft of the radius and ulna measured 1.5 centimeters. So we're going to use this top section here that shows the extremities. It's going to be between 1 and 5 for the settings. So we're going to change our KVP to 60, and then our MAS to 10, and then of course our MA stays at 300. For the craniocaudal radius and ulna, we want to position our patient in the ventral recumbency, and we want to extend that effective forelimb, so that's going to be her left. Cranially, and we want to just kind of move her head to this side, just opposite to the affected limb. We're going to center the beam on the midshaft of the radius and the ulna, and then we're going to collimate proximal to the elbow and then distal to the carpus. To place the left marker lateral to the radius and ulna. Back to our scheduler for the day, and then we're going to go to Dharma's patient clipboard and add it to the patient visit list. Search for x-rays, and we're going to take 2 views and putting it under the doctor who's requested the radiograph. And then the study is going to be the thorax. And now we're ready to take radiographs. Alright, she measured 24 centimeters, so we're going to find our thorax. We're going to go under the 20 to 25 column for the anatomy thickness, and we're going to change our settings to 89 for the KVP. Our MAS is going to change to 10, and then our MA is just going to stay at 300. And we're going to center the beam on the midline at the level of the caudal border of the scapula. To collimate the laterally at that body wall, cranially at the thoracic inlet, and then caudally at that first lumbar vertebrae. Our right marker is going to be cranial next to the armpit. Last view is the VD pelvis, and so we're going to go to our scheduler, go to Dharma's patient clipboard, and search for radiographs in the patient visit list. And for this one, we're going to take one view, put it under the doctor who's requesting the view, and then we're going to be doing a study of the pelvis. Our thickness was the 13 centimeters, so we are going to be doing that VD pelvis. So for the pelvis, we're going to go to our anatomy thickness, which is 13, so between 10 and 15 centimeters. We're going to set our KVP at 76, our MAS at 10, and then our MA here is always at 300. I'm going to go ahead and place her in dorsal recumbency, and we want those forelimbs extended cranially as far as possible. Rotate both of the hind limbs as medial as possible to get the legs straight in our view. We also want the right marker in the caudal area. I'm going to center the beam on the midline between the ischial tuberosities. I'm going to collimate it cranial to the wing of the ilium, and then caudally to the border of the ischium. And I also want to include the proximal third of the femurs. Okay, we're going to review how to retrieve radiographs once you've finished capturing them. Okay, so we're going to go to our scheduler. Up in the top left corner, we have our patient clipboard, so we're going to click on that. It's going to come up with a blank screen here, and we're going to search for Henry. And so now we've found his file, and we're going to go ahead and go into his patient clipboard. And here on the left side, we found his extremity images. So it's going to pull up all of our radiographs that we've taken. Okay. Request radiographs. So we're going to be doing Emerald's barium series today. So we're going to go into her patient clipboard from our scheduler. And then up here in the right-hand corner in her patient file, we're going to go to her patient visit list, search for radiographs, and we're going to be doing multiple views, so I'm going to be adding more throughout the day. But we're going to be putting it under Dr. Anna Coffin, and our exam description is going to be the contrast study or barium series. Giving the liquid barium, and our patient here is Emerald. So we're just going to give her 12. We've finished Emerald's barium study. We're going to go ahead and look at her radiographs, and I'm going to go ahead and explain what we're looking at as the barium moves through the body. So this is our first radiograph, and as you can see, it's at 0 minutes. So the barium has gone into the stomach, and it's already starting to, it's already gone past the pylorus into the duodenum and down the descending duodenum there. This is our 5 minutes after. Our 15 minutes after. Small intestines are very long. And then we're moving, doesn't look like we have any not safe for that. Okay. Okay, so it's moving. This one is our 2 hours post. Okay, and you can see the large intestine there on the side of the stomach. So our barium is moving through nicely. So it's going from the right side to the left. Okay, and so this is our 4 hours post. Looks like everything is moving along great. Ascending colon, and then we've got the transverse colon. For our post view, we've got our descending colon here into the rectum, and then where it meets the anus. According to her barium series, everything looks normal. There are no abnormalities or foreign bodies that we should be concerned about.
Hi, I'm Dr. Anna Coffin. I am a veterinarian and owner of Guthrie Pet Hospital, where Jessica is working and doing her preceptor here. So Jessica's been working on her radiology skills. As far as her strengths, I think she's got the steps on how to go through the process of requesting an x-ray, getting everything set up properly, down very, very well. As far as measuring, she's doing great. We're getting good x-rays. I do think that she needs to work a little bit on her collimation. And then I think the only other comment that I really have is I think this course has really, really helped her with different techniques, especially with limb positioning, using the taping methods and the different restraint areas to actually be safer for us, protecting us against radiation. And so I think that is one of the things that we have benefited from here at the clinic, and then just overall knowledge about radiology. She's really learned a lot. I can see that in her work that she's doing here at this point in time. So you're doing a great job. Keep up the good work.